Okay, Biology 158, we are on chapter 23 now on the respiratory system, and this will be the last chapter or piece of content before the second lecture exam. So to get started, we'll talk about the anatomy of the respiratory system. So the respiratory system is all about getting oxygen in, ultimately to be delivered to your bloodstream, to deliver to the tissues, and then removing carbon dioxide from the blood. You have 7 structures in total that make up the actual respiratory system. So you have what's referred to as an upper respiratory system and a lower respiratory system. Your upper respiratory system consists of the external nose, your nasal cavity, so the space inside your nose, the pharynx, and then the larynx. Then you have your lower respiratory system, which consists of the trachea, the bronchi, and the lungs. So the respiratory system has a lot of different functions. The first and foremost is your ventilation and your respiration. So they sound very similar, but there is a difference. So ventilation is just about moving the air into and out of the lungs, just physically forcing it in or forcing it out, depending on what the body needs. Respiration is the actual diffusion of the gases, so the oxygen across the alveoli membrane into the bloodstream, and then carbon dioxide from the blood across that membrane into the lungs to be removed. So ventilation is just moving the air. Respiration is diffusing the gases across membranes. Your respiratory system also is responsible for regulating blood pH if it's getting too acidic or too basic, as well as producing different kind of chemical mediators. So if you remember from the renin, angiotensin, aldosterone mechanism from the previous unit, that enzyme that's responsible in that mechanism is produced by the respiratory system, as well as many other mediators. Additionally, your respiratory system is responsible for your voice production. So you have vocal cords, which when they vibrate at a certain frequency, actually produce the sound that makes your voice. Your nose is also responsible, as part of the respiratory system, for olfaction. So you have olfactory epithelium, which are able to pick up odorins, which are basically odors. And that will transfer information to the brain, telling you what a certain smell smells like. Lastly, the respiratory system is responsible for protection. So you can have different kinds of lymphocytes, B cells, T cells, moving throughout the respiratory system to fight off infection, as well as general innate structures used to filter out debris or pathogens. So like I mentioned, the upper respiratory system is your nasal cavity, the external nose, the pharynx, and the larynx. The lower respiratory tract consists of the trachea, the bronchi, and the lungs. So starting with the structures, with the upper respiratory tract, we have the external nose, and then within the nose itself is the actual nasal cavity, just the space inside the nose. This runs from your nares, which are just the openings, your nostrils, getting into the nasal cavity, all the way to your choana. And these are basically the posterior openings at the back of the nasal cavity that lead to the pharynx, which is the next structure. You then have a hard palate, which is basically the floor of the nasal cavity, and this is bone, as well as your nasal septum, which is also a bony structure dividing into several cavities. Much of this you probably covered when you did the skeletal system in 157. Additionally, you have those concha structures, which are the bony ridges along the walls that have meatuses or little ridges between them. These lead to a lot of your sinuses as well as your ducts. So ultimately, your nasal cavity is responsible for getting air in initially. So when you breathe in, you take in air through the nostrils, and the nasal cavity itself is able to clean and warm that air for making its way to the lungs. Additionally, as I said before, you have olfactory epithelium, which transfer odorins to signals to the brain to tell you what a smell is, as well as different sinuses for speech. The next structure in the upper respiratory tract is your pharynx. So your pharynx has a sort of shared responsibility. It's an opening for both your digestive system and your respiratory systems. And the pharynx is basically broken down into 3 subregions. So you have a nasopharynx, so with the nose, naso. You have an oropharynx with the mouth, and you have a laryngopharynx. Your nasopharynx is responsible for structures such as the soft palate, which the uvula extends off of, and in your nasopharynx, that's responsible for helping you swallow mucus and other debris. Your oropharynx with the mouth, like I said, shares with the digestive system. And then it has a structure called the fauces. The fauces is just where your oral cavity, or your mouth, joins with the oropharynx. And then you have your laryngopharynx, which is defined as basically being your epiglottis, which is a piece of cartilage we'll talk about in a second, running all the way to your esophagus. So to point out some of those structures, we have a sagittal section here of an individual. Nasal cavity is the space inside the nose. It has all the different concha, the superior, middle, and inferior, as well as the nares, which is just the opening to the nasal cavity. Then you also have your choana, which is the area that leads to the pharynx. Speaking of the pharynx, we have the different breakdowns of the pharynx itself. So the nasopharynx is the first portion leading from the nasal cavity, then leads to the oropharynx, which is at the back of the throat, or contains the area at the back of the throat called the fauces, leading into the rest of the pharynx. And then your laryngopharynx. Runs behind your larynx down to the esophagus. And that's pretty much it for that slide. Yeah, we'll talk about the larynx. Okay. So next is your larynx. This comes after your pharynx. Your larynx is just the voice box predominantly for your speech. It has a lot of different cartilage structures within them. You have what's called unpaired cartilage and paired cartilage. So on the unpaired cartilage side, you have the thyroid, the cricoid, and the epiglottis. Then paired, you have arytenoid, corniculate, and cuneiform. And then you have two ligaments, which you remember from when you talked about bones. Ligaments are just pieces of connective tissue that connect bone to bone or cartilage to cartilage. And since the larynx is primarily cartilage, the ligaments are just connecting pieces of cartilage together. Two important ligaments we have are what are called your vestibular folds, and these are what's referred to as your false vocal cords, so these don't actually produce sound. And then you have your vocal cords, which are your true vocal cords. These actually produce sound. And then within or between your vocal cords and the vestibular folds, you have the opening, which runs between the glottis. Or sorry, the opening between is the glottis. So point out those structures. Here we have an anterior view of the larynx. Biggest piece of cartilage is the thyroid right here. Then below it, you have your cricoid cartilage. And then above, next to the hyoid bone, you have your epiglottis. If we look at a posterior view, like in section B right here, again, we have your thyroid cartilage, a piece of it here, and a piece of it here, that cricoid cartilage below, and then that epiglottis. So then for your additional cartilage, you have your arytenoid right here, your corniculate attached to your arytenoid, and then your cuneiform cartilage up here. And with this lateral or this medial view, again, you have your cuneiform, which is a little piece up here, your corniculate, which is then attached to your arytenoid. So for the vestibular and vocal folds, at the top of the larynx, you have the opening right here, which leads down to your trachea, which we'll get to in a moment. But immediately surrounding the opening, you have your vocal folds, these white lines I'm running my mouse over. Those are your true vocal cords. Those produce sound, which allow you to speak. And then surrounding those, you have your vestibular folds on both sides. Those are those false vocal cords. They do not produce sound. You then have the epiglottis right here, which can basically cover the entire opening to block it from having food go down your windpipe. So when you're eating and you're about to swallow, this glottis will close up. Those vocal cords will come together, blocking the space off. and the epiglottis will fold on top of it. So you basically have a complete sealed off area to the trachea. So if you were to have food go down there, that would initiate choking or cough reflex. But the reason we don't have that happen very often, thankfully, is because we have these two structures in place to close up the hole. So larynx is a couple of different functions itself. First and foremost is that the thyroid and cricoid cartilage, those big pieces of cartilage, allow the structure to maintain open, so air can keep coming in. Of course, we want air to keep coming in so we can keep getting oxygen to the tissues and keep getting carbon dioxide out of the tissues. Like I mentioned, you have your epiglottis and your vestibular folds, which can close up that space so swallowed food doesn't go down your trachea, it goes down your esophagus and leads to the stomach. The vocal folds, again, produce sound so you can speak. And then within the larynx, you also have a special type of epithelial tissue, if you remember way back in 157, called pseudostratified ciliated columnar epithelium. This tissue has your cilia on it, which are able to catch debris and basically sweep it back up out of the larynx. Next is the trachea. So now we're on to the lower respiratory tract. So your trachea is basically just a giant tube of regular connective tissue. So that's connective tissue that has fibers running all in one direction for structural support. And surrounding that trachea, we have that smooth muscle. And then within the inner lining of the trachea, we have your pseudostratified ciliated columnar epithelium with those goblet cells. So those goblet cells have a very special function. Those goblet cells produce mucus, which ultimately are going to trap the debris and make sure it can't move any further down into the trachea, because we don't want junk and debris going into our lungs. We want to keep the airways clean. Then, once those goblet cells produce that mucus and trap that debris, you'll have your cilia, since they are, the epithelium is ciliated. That cilia is going to then sweep that debris back up the trachea and get it out, get it to the larynx, pharynx, and then hopefully out as you breathe out. So show you some diagrams here. We have your trachea tube right here, made of all of that dense regular connective tissue, all the fibers running in one continuous direction, sitting just in front of the esophagus. Then surrounding the lumen, or the actual space of the trachea, we have that epithelium, which has your goblet cells that produce that mucus. And then those pseudostratified epithelium have the little hairs, so there's little cilia. So once the goblet cells trap the debris or pathogen or whatever in the mucus, those cilia cells can sweep it back up. Next, we have the bronchi. So the trachea is the actual windpipe tube that leads down to the bronchi. Eventually, your trachea will sort of hit a fork in the road, and there will be a left bronchi and a right bronchi, with a ridge between the bronchi called the carina. And this carina is super sensitive to any sort of mechanical stimulation, meaning touch or feeling. The idea behind this is that if something were to get lodged in the trachea, or something were to irritate it, that would initiate what's called the cough reflex, which is just coughing. You want this to happen because, again, if you have debris in the trachea, we don't want that getting into the lungs. So you want that cough reflex to be initiated so we can clear the airways of whatever debris or whatever may be choking, whatever we may be choking on, excuse me. So the overall structure or branching pathways is called the tracheobronchial tree. So this is just the trachea and then all the networks of bronchi that extend off of the trachea. So this gets a little confusing, that it's kind of like a Russian doll. So within every structure, that leads to branching of smaller structures, all the way from the largest bronchi to the alveoli. But I will break all that down for you. So we have what are called your main bronchi. You have the left and the right. From your main bronchi, you then have what are called lobar or secondary bronchi that come off of the main bronchi. Off of your lobar or secondary bronchi, you then have segmental bronchi that come off those. Your segmental bronchi then branch again and become bronchioles. Those bronchioles then branch again and become terminal bronchioles. So it's main bronchi, lobar bronchi, segmental bronchi, bronchioles to terminal bronchi. So recap all that real quick. We have the larynx filled with cartilage, that trachea or that windpipe tube leading down to the fork in the road, leading to the right and left main bronchi with that carina in the middle. Carina, again, can initiate that cough reflex if it's irritated. So we have the main bronchi, which lead to a secondary structure called your lobar bronchi. Then once we come off the lobar bronchi, we have additional branches called the segmental or tertiary bronchi. Off of the segmental bronchi, we then have your bronchioles. And then off of your bronchioles, we then have your terminal bronchioles. So again, we're having branches coming off of branches coming off of branches. While confusing, the idea behind this is to increase the amount of surface area across the lungs so we can have more surface area to diffuse oxygen across and carbon dioxide across. And with your bronchi, you have two conditions that can be met. You have bronchodilation or bronchoconstriction. These are not very new terms to you. You've heard this a lot from the cardiovascular unit when we talked about vasodilation and vasoconstriction. Same exact idea, except we're just swapping the prefix with broncho instead of vaso. So broncho is just the bronchioles. So when something is bronchodilated or undergoes bronchodilation, that smooth muscle surrounding the bronchioles relax. So we increase the amount of space that air can flow through, which decreases resistance. So we have increased airflow. If we have bronchoconstriction, that just means the smooth muscle around the bronchioles is contracting now. So now we have greater resistance to airflow. So the airflow is going to decrease because we have less space or less volume that the air can move through. And this is linked to what's called an asthma attack. So when you have some sort of irritant that causes inflammation, something that can happen is vasoconstriction in the cardiovascular system or brachioconstriction in the bronchioles. And when that happens, that will tighten down, thus decreasing our airflow, which means it's harder to breathe, such as someone who is undergoing an asthma attack. Okay, so then we get even further from the bronchioles to the alveoli. So your alveoli are the actual sites where we have respiration going on. Remember, respiration is when we have oxygen diffusing from the alveoli tissue into the blood, and then carbon dioxide from the blood into the alveoli. So again, like I mentioned with that Russian doll analogy, continuing on from the never-ending structures coming off of structures with the terminal bronchi, we then have more structures in the alveoli. So we have those terminal bronchioles, which came from bronchioles, which came from tertiary, which came from secondary, which came from main. Off of the terminal bronchi, or bronchioles, we have what are called your respiratory bronchioles, which branch off those terminal ones. We then have your alveolar ducts, which come off your respiratory bronchioles. We then have your alveolar sacs, which come off your alveolar ducts. And then in the alveolar sacs, you have individual alveoli. So to run through that real quick. So terminal bronchioles branch off into respiratory bronchioles. Respiratory bronchioles branch into alveolar ducts. The alveolar ducts will get to an alveolar sac. And then within the alveolar sac, you'll have individual alveoli, which is what I'm circling right now. So realize it's a little confusing, but it's just smaller structures branching off of larger structures, and it keeps going all the way from your main bronchi to your alveoli. So the alveoli are very plentiful within the body. You have roughly 3 million of them within the two lungs. And again, the reason you have so many of them is because you have the need to increase the amount of surface area, so you have more space to diffuse oxygen across. So you can get more oxygen into the blood, which means you get more oxygen to the tissues, which is what you want. Within the actual alveolar wall, the actual tissue, you have two kinds of cells. These cells are called pneumonocytes. So prefix kind of like pneumonia. So type 1 pneumonocytes are involved with the actual gas exchange. They're covering the surface of the alveolus. These are going to help your oxygen get to your blood, your carbon dioxide get from the blood to the alveoli. You then have your type 2 pneumonocytes, and these are cells that are going to secrete a substance called surfactant. Surfactant is about decreasing the surface tension within the air-water membrane within the lungs. The idea behind this is basically it's going to help your alveoli expand more when you inspire. So when you take breath in, that's going to allow those alveoli to expand from the surfactant, which is going to allow more oxygen to get to the alveoli to be diffused across. So just think surfactant helping with inspiration, getting more oxygen in. Okay, and then the actual membrane that the oxygen and carbon dioxide diffuse across is called the respiratory membrane. So this is the literal location of pulmonary respiration. So oxygen always entering the blood, carbon dioxide always leaving the blood. We want oxygen, of course, to go in, get to our tissues, carbon dioxide to come back from the blood and remove from the body. So to recap some of that, we have two types of cells, your pneumonocytes. Your type 2 is over here that I'm circling within the zoomed in alveoli. So type 2 produces that surfactant, which again decreases surface tension, allowing for the alveoli to expand more, allowing for more oxygen to come in. Then you have your type 1 pneumonocytes, which are able to aid oxygen diffusing across and aid carbon dioxide diffusing across the respiratory membrane. The respiratory membrane itself is a very thin layer, just has a lot of pieces to it. So within the alveolus, which is the smallest structure within the lungs, you have your thin fluid layer. You then have a layer of epithelial tissue with a basement membrane, then a little space between, this is the white I'm running my mouse over, then another basement membrane for the connective tissue or the capillary endothelium. Sorry, not connective tissue. Endothelium is not connective tissue. Sorry, capillary endothelium, and then the tissue itself, and then the bloodstream. So again, looks like a lot of different layers across the respiratory membrane, but this is ultimately a very thin amount of space to get oxygen and carbon dioxide across. And that's what we want, because we want a thin membrane so things can easily diffuse across them. So taking a step back real quick from that very microscopic look at the alveoli, additionally surrounding the lungs themselves is your thoracic wall, as well as a handful of muscles. So your thoracic cavity, the actual space that contains the lungs, has a very important muscle called your diaphragm. When you utilize ventilation, so just breathing in or breathing out, there's going to be changes to the diaphragm as well as those surrounding rib bones to accommodate air moving in or accommodate air moving out. So when you inspire just means take air in. What's going to happen with that diaphragm is going to contract and lower itself down. So as you breathe in, your lungs are going to expand. They're taking oxygen and anything else in the air inwards. And because those lungs are expanding, they're going to move downwards. So that diaphragm muscle is going to contract and move down, giving more space for the lungs. Additionally, the lungs are also going to expand outward, so to the left and to the right and forward, and that's where your ribs are. So to make way for that, your ribs are going to sort of swing out of the way. Your book gives an analogy of them being kind of like a bucket handle that you can sort of swing up and out of the way if you need to get something through that area. So diaphragm, contracting, moving down, ribs spreading out or swinging up out of the way so those lungs can expand during inspiration. Then during expiration, so when you're breathing out, that diaphragm is going to relax. That's going to have the diaphragm move back up, thus condensing the space that the lungs have. And then the ribs are going to swing back in, compressing the lungs as well. That's going to help push air out of the lungs, ultimately to your trachea and your larynx and your pharynx, and out of the oral cavity. So then we get to the lungs themselves. So lungs are the actual organ for respiration. I know we went very in the weeds with the bronchioles and the alveoli. Now we're talking about the lungs as more of a whole. So much like your heart, they have a base as well as an apex. So base bottom, apex top. Then they have a little hole in them that's called a hilum. The hilum is basically the space for all of the vessels to come in. So all of the bronchioles, all the blood vessels, all the lymphatic vessels, everything that needs to get into or out of the lungs goes through the hilum. Your lungs have a right lung and a left lung. That right lung has 3 lobes with fissures separating them, and the left lung has 2 lobes with various fissures separating them. Your left lung also has a very important structure called the cardiac notch. This is a little indentation within the left lung that allows for the heart to fit in between the lungs. So it's sort of a little mold or a crease that the heart sort of fits into nicely. Then you have your divisions. So you have lobes within the lungs, which have your lobar bronchi, which is the secondary bronchi coming off the main bronchi, as well as different segments and lobules. So to point some of those out, right lung and left lung, this is in a medial view. So we're looking, if we were at the core of the body looking inward, this is what we'll be seeing. So with your right lung, you have that superior lobe and the inferior lobe, and then the hilum where all the blood vessels are coming. So your blood vessels and your lymphatic vessels and your bronchi. And then down here, we have a lateral view of the lungs. You don't need to know all of these colored sections. This is just to illustrate the superior lobe, the middle lobe, and the inferior lobe on the right lung, because the right lung has 3 lobes. And on the left lung, you just have the superior lobe and the inferior lobe. And then between lobes, whether we're looking at the right lung or the left lung, we have fissures separating them. So where I'm running my mouse along for the right lung, and then where I'm running my mouse along for the left lung. So in terms of getting blood and lymphatic supply to the lungs, we know that those vessels run through the hilum, which is the actual space that allows them to get into the lung tissue. And blood itself moves from the pulmonary artery. We know this from the cardiovascular unit. Gets pumped through the trunk to the arteries to bring that deoxygenated blood to the lungs to become oxygenated and then go to the rest of the body. Once that deoxygenated blood comes to the lungs, it goes to the right side of the heart and then continues on. However, much like your heart with the coronary arteries, you do need to get oxygenated blood itself to the lung tissues. So remember, every tissue in the body has to get oxygen to it, regardless if it actually is providing the oxygen. So your oxygenated blood is going to travel through a special type of artery called your bronchial arteries. So it makes sense because it goes to the bronchioles. The bronchioles are going to go to those capillaries, and then that deoxygenated blood, once it drops off that, is going to exit through the aptly named bronchial veins, and then to a special system called the azygous venous system, which is then going to return that deoxygenated blood to the heart. So again, pulmonary artery pumps deoxygenated blood to the lungs to become oxygenated to then go to the rest of the body. Oxygenated blood also deposited through the bronchial arteries to the capillaries, returns to the bronchial veins and the azygous venous system. That's your blood. Then, of course, we have your lymphatic supply. So remember, lymph is that sort of filter fluid that's being carried all throughout the body. It's a little simpler. You just have a superficial lymphatic vessels, and then you have deep lymphatic vessels, both of which exit from that opening to the lungs or the hilum. So the superficial vessels drain more of the superficial lung tissue, and then your deep lymphatic vessels drain the bronchi and any sort of deeper connective tissue. So pretty straightforward. Superficial drains superficial, deep drains deep. Then we have the actual space that the lungs are taking up. So you're familiar with the mediastinum from the cardiovascular unit. This is the central region that contains a lot of different structures like the trachea and the heart. But then you actually have the cavity itself that contains the lungs, which is called the pleural cavity. So the pleural cavity surrounds both the right and the left lungs. and ultimately forms your pleural membranes. And those pleural membranes have two layers. You have that visceral pleural membrane, which is right on the lung surface. And you have that parietal pleural membrane, which is on the which is the outer membrane. So with that, we have the mediastinum, which is what I'm circling right now, that contains the heart. Then you have this pleural cavity white space that I'm drawing my mouse over. This is the space that contains the lungs. Within that pleural cavity space, you have the serous membranes. So you have that visceral pleura on the surface of the lungs, and then that parietal pleura across the pleural cavity.